Yeah. So I am Dr. Aniruddha Mahindrakar. I am the ophthalmologist and I am practicing in Andheri West. We all know that our eyes are one of the most important sensory organs and we depend on our eyes significantly for our day-to-day activities. And is very important for us to understand the message that eyesight, our vision, is the most important sensory part of our body. हमें यह समझना बहुत जरूरी है कि अपनी आंख अपने दैनंदिन काम के लिए बहुत जरूरी है. So let us start with this good activity of improving the general awareness about the eyesight and eye related questions. So I will start sharing the screen now. So protecting and taking care of our eyesight. This is the most important aspect of our daily eye care. So eyes are the windows to the soul. This is an expression that is often used. Vision is a window to the world. With vision, we cannot do anything and we connect with the others. With vision, we feel the happiness. 80% of our memories are determined by what we see. And today on the World Sight Day, it is an annual global event which draws attention on blindness and vision impairment. So the objective of this World Sight Day is to create awareness about eye care, vision, about blindness and its treatments involved in improving the vision. This day focused on drawing attention to leading causes of blindness or visual impairment, which are like cataract, glaucoma, refractive error. The statistics show that 2.2 billion people have unaddressed vision impairment. Amongst this 1 billion people have vision impairment which can be avoided. मतलब ये हम लोग पूरी तरह से रोक सकते हैं. As per a recent survey, approximately 2% of India's population is blind, which means 1.1 million people are blinded by only corneal related blindness, and more than 1 lakh corneal transplants are required annually in India. However, there is a shortfall and we are doing only about 25,000 nowadays. So sight is physical. So what we experience through our sensory system is sight, and vision is what our mind perceives. There is a difference. Sight allows a person to witness an event, but vision helps him to understand the significance of and draw interpretations. Protecting your eyes and your sight is highly important so that we may avoid harm to it. This is the basic anatomy of the eye. We can see when the eye is cut open, there is a lens, then there is retina which is behind, and the light travels through the cornea, passes through the lens, is focused on the retina, and then the image passes through the optic nerve and reaches our brain. So the common problems could be different in different age group, like children and old people. So refractive errors like astigmatism, myopia, hyperopia, dry eye, digital strain, allergic conjunctivitis, color blindness, and night blindness. This can be there in all. But in children, specifically, we have amblyopia, which is lazy eyes, strabismus, which is squint, and ptosis, जिसमें एक आंख की पलक नीचे आ जाती है. In older people, we have presbyopia, cataract, जिसको मोतियाबिंद बोलते हैं, glaucoma, जिसको कांच बिंदु बोलते हैं, age-related macular degeneration, और diabetic retinopathy. So what is myopia? Myopia is nearsightedness. In these cases, things which are near are clear, but far objects look blurry. The eyeball is longer than normal eye length, and the image is formed before the retina in the eye. Hereditary in nature. So symptoms, usually it occurs in childhood. There is some squinting of the eye, sometimes headache. Treatment is usually spectacles. Power of spectacles can be shown as -3 D is diopters. Okay. Apart from spectacles, contact lens can be used, and even in suitable, appropriate age group, laser eye surgery is a great option. What is hyperopia? Hyperopia is another refractive error, which is farsightedness. Distant objects are clear and near objects are blurred. The eyeball is shorter in size than normal eye, and the image is formed beyond the retina in the eye. It usually occurs in older age group. Trouble reading as words are blurred, need to squint to see better. Headaches are usually after one reads. Again, treatment is spectacles. In this, it is plus 3.0D, that is diopters. So in myopia, it was minus. In hyperopia, it is plus. For some, contact lenses can be used. Over the age of 18 years, again, laser surgery is a great option. What is amblyopia? This was specific for children. In this, a patient, the brain focuses on one eye more than the other, and the other eye is ignored, causing it to be lazy. So vision is not normal, even though there is no obvious problem in the eye. So there is no obvious symptom, but the patient cannot see in that eye. And early diagnosis is very, very important. So that treatment is more effective, as it is important to have healthy and normal vision from both eyes. Again, treatment is prescription of spectacles. Patching is a great way to treat, so that workout of the lazy eye is done, so that it will catch up in its development process. Amblyopia can be diagnosed as early as 2 years of age. So important to examine the children. Astigmatism, in which the cornea contributes a large part and is not so round perfectly, and hence there is distortion of vision. Astigmatism can be present in young children and could develop during puberty. In children, astigmatism is a common cause of lazy eyes. Again, the symptoms are headache, eye strain, squinting, distorted or blurred vision, difficulty driving at night. And treatment is again spectacles, contact lenses, or refractive surgery candidates. So it is squint. Squint is called as strabismus. More commonly known as cross, commonly occurring in or infants. The condition causes a misalignment of the eyes. One eye looks straight and the other eye looks either upwards, inwards, downwards, left or right. Causes muscle dysfunction, farsightedness, trauma, genetics. So symptoms are blurry vision, double vision. Sometimes there can be headache, excessive squinting. In some cases, development of the lazy eye, that is which we saw before. Treatment options are a lot. Tasks can be prescribed. Exercises are advised. Even surgical treatment may be done. Many improve with the surgical treatment. So what is ptosis? This is droopy eye. One eye looks small because the eyelid is down. So it affects either one or both eyes. The eye may be covered slightly or entirely. It is hereditary and the child can be born with one, and it may obstruct the natural development of child's visual ability and result in lazy eye. The condition usually doesn't become better on its own over time. Children may need treatment such as surgery in order for vision to develop properly, and appropriate consultation with your doctor should be done when we see inequality in closing both the eyes or the eye looks smaller. So now we come to corneal ulcers. We can see a small white spot on the cornea, which is an open sore. Cornea is that clean layer over the iris. The corneal ulcer is usually caused by infections or sometimes injuries, also known as keratitis. In this, the eye becomes red. There is a feeling of some pricking sensation. Pus may come out, or there can be thick discharge. There can be pain, swollen eyelids, and as I said initially, there is a white spot. Infections are the most common causes. Bacteria, virus, fungus, and parasites can be the etiological agents. Medications, including drops, which are antibiotics, antivirals, are used. Sometimes these might have to be given every 1 hour. If not responding to this treatment, even operative treatment, that is surgery, is an option. This is conjunctivitis. This is the more common occurring disease. And this red eye or pink eye, as it is known, is an inflammation of the conjunctiva, which is the transparent membrane. It is relatively benign, caused by bacteria and virus. Though it is irritating, it does not affect the vision, and treatment helps in easing the discomfort. It can be contagious, so early diagnosis and treatment will help in restricting its spread. Redness can occur in one eye or both eyes, itchiness, gritty feeling, discharge, and lot of watering, that is tears can secrete. So the causes are bacteria, virus, or even allergies. Prevention, good hygiene, washing your hands. Do not touch your eyes with hands or napkin used by another person. Use a clean towel. Don't share your towels or personal eye care. Treatment is usually focused on symptomatic relief. We use artificial tears, warm, wet cloth. These can be used several times a day. Contact lens wearers should stop wearing contact lenses, and in most cases, this resolves on its own. Sometimes, in bacterial cases, antibiotics can be used. Now, cataract, this is one of the most common cause of treatable blindness. Cataract is clouding of the normally clear lens of the eye. Seeing with cataracts is like seeing through a frosty or fogged up window. So the symptoms are blurred, clouded, or dim vision, halos around the lights, problem seeing at night through light or glare, faded view of colors, frequently changing contact lens or glass prescription. Prescription glasses for cataracts can help in early stages, but surgery is often required later. Causes, this can be surgical or it can be without any underlying cause. Hypertension, alcohol, hormone replacement, high exposure to UV light, and even poor nutrition or smoking can contribute to it. Surgical treatment is an option. This is the only option. When should we consider that? Whenever there is blurred, clouded, or dim vision and halos around lights, problem seeing at night through light or glare, faded view of colors, frequently changing contact lens or glass prescriptions is required. So nowadays we do cataract surgery with special advanced phacoemulsification technique, wherein a very small entry is made and the great advanced phaco machines go inside the eye. They suck out the lenticular matter which is defective, and in its place a new crystal clear IOL implant is injected. All this without any injection, without any pain or discomfort to the patient, and the patient can walk back home on the same day. So this is about the cataract surgery. So in some cases where we prohibit the use of an artificial lens, once the cataract is removed, in that case, eyeglasses or contact lenses can be used. Usually, as I said, cataract surgery is an outpatient surgery, and it is very, very safe. After the procedure, there might be some discomfort for which drops are given. Usually, healing takes place in between 4 to 8 weeks after the operation. So thus, we remove the clouded lens and implant an artificial lens, which improves the patient's vision. Now we come on to glaucoma, which is also called as kala motia. This causes damage to the optic nerve, which takes the image we see in the eye to brain, where it is interpreted. This happens due to buildup of high intraocular pressure in the eye. Glaucoma occurs when the eye cannot drain excess fluid, causing increased pressure in the eye and irreversible damage to the nerve. This damage causes vision loss and even blindness in some cases and is irreversible. Glaucoma, called silent thief of sight, as it has no warning signs. This is very important. And the patients, by the time they come, there is almost sometimes no treatment that can be done. Risk factors: age, over 60, family history, certain medical conditions such as diabetes, heart disease, high blood pressure, extremely nearsighted or farsighted, having had an eye injury or certain types of surgeries, taking some specific medications like corticosteroids, eye drops for a long time. If a diagnosis is made in its early stage and treated appropriately, vision loss can be slowed or prevented. Treatment is required for the rest of the life. So diagnosis: during a glaucoma examination, we measure the eye pressure using tonometry. We inspect the eye's drainage angle using gonioscopy. We examine the optic nerve for damage using fundoscopy. We test the peripheral vision using perimetry, and we measure the thickness of the cornea using pachymetry. Now, treatment is with lowering eye pressure with the help of eye drops or oral medications or laser treatment, or sometimes even a combination of this, and in the advanced stages, even surgical treatment. So eye drops, this can help decrease the eye pressure by improving how fluid drains from the eye, or by decreasing the amount of fluid that is produced in the eye. Depending on how your eye pressure needs to be, more than one of the eye drops can be prescribed. Surgery and other options include laser therapy, wherein trabeculoplasty is done with the help of a laser beam, filtering surgeries with procedures like trabeculectomy, wherein a special drainage path is created. Drainage tubes can be implanted. These are shunts which are inserted so that the fluid can get drained very well. And now advanced minimally invasive glaucoma surgeries. These require immediate treatment and fast recovery and have less risk than trabeculectomy. Now, what is age-related macular degeneration? ARMD. We can see the left picture is of the healthy eye and the right is with degenerated macula. Macular degeneration is also known as ARMD. Fourth most common cause of blindness. People find it hard to recognize face, drive, read, or perform other activities. Visual hallucinations can also occur. Typically happens in older people. Dry AMD, which is the different form, can become wet AMD, which is another form wherein there is formation of choroidal neovascular membrane and leakage and hemorrhage can occur. And this treatment is required for a long term in this case. There are two types, dry, which is most common in 90% of cases, and wet, which is relatively rare. So risk factors are hereditary, smoking, and obesity. You can diagnose this with the help of optical coherence tomography or fluorescent angiography. Optical coherence tomography or OCT is the 3D image of the cross section of the retina. It helps the doctor, that is us, to see the retinal layers if they are distorted and there is swelling. Whether it is responding and getting better, that can be assessed on OCT. Fluorescent angiography, a dye is injected and photographs are taken. The images will show new vessels or vessels that are leaking fluid. A small area at the center of the retina is seen. So treatment for dry AMD, oral antioxidant medicines are given. Many times NSAID drops are also prescribed. Newer treatments are also available, but at present there is no definitive treatment. For wet AMD, intravitreal injections of anti-VEGFs help in improving and slowing or stopping the progression of the disease. Now, diabetic retinopathy, it is one of the most common causes of vision loss in diabetic patients. At first, diabetic retinopathy may cause no symptoms or very mild visual symptoms. Eventually, it can cause blindness. The condition can develop in anyone who has either type 1 or type 2 diabetes. The longer you have diabetes and the less controlled your blood sugar is, the more likely you are to develop this disease. It is very important to diagnose it early. How can we diagnose? Spots of dark strings floating in the vision is seen. These are called as floaters. Blurring of vision, fluctuating vision, impaired color vision, or dark or empty areas in the vision can be seen. We can see the pictures on the right-hand side of the screen. This is the normal one, and on the right side is the diabetic retinopathy picture. Risk factors, duration is one of the most important risk factors. The longer you have diabetes, the greater is the risk factor. Poor control of blood sugar, high blood pressure, high cholesterol, tobacco use, all these are high risk factors. Treatment is geared towards slowing or stopping progression. It combines controlling systemic factors like blood glucose and local treatment, which can be laser or again intravitreal anti-VEGF injections. Eye strain. The term eye strain describes a group of symptoms which occur in some people after extended use of the eyes. Although eye strain can be uncomfortable, it may not lead to any eye damage. Extended computer or other devices used with inadequate or excessive lighting may cause eye strain. Although eye strain can be annoying, it usually is not serious and goes away once you rest your eyes. In some cases, signs and symptoms of eye strain are a sign of an underlying eye condition that needs appropriate treatment. Although you may not be able to change the nature of your job or all the factors that can cause eye strain, however, you can take some steps to reduce the eye strain. Overexposure can harm the eyes. So it can cause blurred vision, redness, eye irritation, intense headache, stinging, feeling of disorientation, watery eyes, difficulty in focusing. Due to COVID-19 lockdown, the increased use of digital devices has caused tremendously increased problems with eye strain. So television watching, news, smartphone uses has increased significantly. And nowadays, video on demand, that is web series nowadays, has become very much in vogue and it is being used by almost everyone. Chatting, social media, these are also consuming a lot of time and putting the eyes into a lot of eye strain. So impact of eye strain causes difficulty in reading. So this all affects the eye strain significantly. We cannot see properly. The dust affects working on laptops can create problems while shopping in grocery shops. It can affect us. So what we need to do is that we have to keep a proper distance from the object that we are watching. For near vision, it is 25 inches. We have to lower the screen brightness. We have to follow 20-20-20 rule. We all know cricket 20-20. So remember that 20 minutes, look at a distance of 20 feet for 20 seconds. Wash your eyes regularly. At night time, we have to reduce the blue light exposure significantly. So you have to adjust your settings accordingly. Consider turning off some of the overhead lights while you're working on your screens, desktop or laptop, so that the intensity is reduced. Blink more often. Be conscious. While you are looking at the screen, remember to blink more commonly, more frequently than what you are blinking otherwise. A regular eye checkup is mandatory. An eye exam involves a series of tests to evaluate your vision and check for your eye diseases. Each test during an eye exam evaluates a different aspect of your vision or eye health. An eye exam helps detect eye problems at early stage when they are most treatable. Regular eye checkup helps early detection of eye disease and helps them treat better. So eye checkup is not just going to any optical shop to check your eyes, but a complete detailed checkup which involves visual acuity testing, refraction assessment, slit lamp examination, dilated fundus examination, which is also called as retinal examination, screening for glaucoma, and visual field testing are very important. When should we do the testing? Children between 3 to 5 years should undergo a comprehensive eye examination. If there are no symptoms or family history of eye disease, once every 1 or maximum 2 years is an appropriate way. In adults, every 5 years between your 20s to 30s, every 2 to 4 years between 40 to 55, every 1 to 3 years between 55 to 65, and every 1 to 2 years after 65. So we all know that eyes are very precious, and we all saw that our country is lacking significantly in the available eye for preventive and treatment purposes. So we need to improve the availability of eye to treat eye diseases. So that is possible if every one of us pledges to donate our eyes and light up another life who has been blind till now. So let's pledge to help the visually impaired to see the beauty of life. We can visit the website ebai.org and find out about it from there. Anyone can donate the eyes. It's very, very important to know that so that the availability of corneas is increased. Thank you. And so that was about the importance to take care of the eyes. We all know how precious our eyes are. We need to take care of our eyes. In fact, the younger generation is very much predisposed because they are exposed to these screens. Nowadays, even school children have to attend schools online, which involves watching the PowerPoint presentations on tiny mobile screens, causing significant problem in children. So children need to take care. They have to have good diet, increase the content of leafy vegetables, fruits like papayas, carrots, beetroots for children, avoid junk food. It's very, very important to take precautions and blink frequently. Even the teachers are significantly exposed to the screen. So taking care is the only way, and at the same time, an appropriate eye examination is mandatory. Any queries or any comments can be sent to us, and we will give reply to those comments. Thank you. Over to you, Rao. Hello. Rahul, are you there? Sachin?
हेलो हाँ हाँ सर मी आहे I will
Yes,
check
sir.
with the
चालू
Rahul
है.
sir. Hello
Yeah.
sir, talk was nice sir. I will check with the Rahul. So we will
Yeah. Thanks, sir.
so you can leave sir.
Okay. Thanks, sir. Thanks a lot.
Thank you sir.